Babies born through vaginal birth come out with some form of molding of their skull. You see that molding, like you see the shape of their head, it kind of a bit long one side, a bit more protruded than the other. That is, it happens because of the pressure that the baby puts on the pelvis, the mother's pelvis, as they go through the birth canal to be born. This molding is made possible because of the presence of sutures. Sutures are membranous tissues in between the baby's skull bone, and that's what is what makes it possible for the head to just compress, yeah, and relax also, and makes the normal form or shape of the baby's head when they're eventually born. The sutures are also there to enable the skull bones expand in a bid to accommodate the growing brain as the baby grows also in latter days. Now, the point where two or more sutures meet is what we call the fontanelle. That is that pulsating thing that you see in front of your baby's head, and there's a second one that is at the back. That one in front is called the anterior fontanelle, while the one at the back is the posterior fontanelle. Yes, the anterior fontanelle is expected to close, say, in about the 18th month of the your baby's life. When the baby is about 18 months old, that is basically a year and 6 months old, while the posterior one closes at about 4 to 6 weeks of the baby's birth. Now, what brings this video is making me do this video is I see a lot of parents, a lot of mothers put some form of concoction on the baby's fontanelle. That's a very terrible thing to do, because there are also blood vessels and the baby's scalp that this things can just seep into and goes into their bloodstream, causing neonatal sepsis, making your baby sick, fever and all that, which is very detrimental to the life of your babies. If you notice any form of depression on that part, known as what we call sunken fontanelle. Sunken fontanelle usually happens as the major cause is dehydration. It means you're not feeding your baby enough. Your baby's not getting enough milk. So you should feed your baby. Feed the baby on demand. Babies should not be timed. They are supposed to be fed on demand. It's only in about after 3 months or so that you are supposed to put the baby in some form of routine. Otherwise, you should feed the baby whenever they want to eat. That is only ground where your baby's fontanelle would look normal. If it is sunken, it's mostly dehydration that is the cause. So feed the baby, give the baby enough fluid to take, so as to get the fontanelle back to normal, back to what it should be.